Hello, I decided to do basal cell cancer. It is the most common type of skin cancer and it affects mainly people 41 years or older, according to the Mayo Clinic, but it can also affect anyone from any age. And more than 3 million US cases are found every year, so that's a lot of people. The risk factors are having fair skin, light hair and eyes, if you're a male and if it's in your family history. It's caused by long-term exposure to the sun or UV light or intense sunburn, so that's why it's important to wear sunscreen. I also thought that this was an important one to talk about at this time of year because I work at a pool, and so I always try to stress the importance of wearing sunscreen and protecting your skin while you're out in the sun. So normally our basal cells live on line our skin, and they replace the old ones with new ones whenever they're damaged. Cancer in the basal cells look like bumps, sores, scars, or different colored patches, usually red, and they're usually on the face or your neck or your shoulders because that's where the sun hits us the most. So whenever you're being diagnosed, usually you'll probably see something on your skin that doesn't look normal, but you can go to your dermatologist, and if they find these bumps or discoloration, then they'll have you do a biopsy, and if they think that it's cancerous, they will talk about options with you, or if it is really big and it's growing, then they'll send you to your doctor, and your doctor will examine it, do a biopsy, and you'll probably at that point need surgery. So they'll usually cut, if it's not too bad, they'll just cut the skin, just a thin layer of the skin. So it's really not that much, but if it's pretty deep and there's big patches of it, then you'll have a bigger excision, and so it'll take longer to recover from surgery, but usually the recovery is pretty easy, and people come back from it fairly quick. They usually experience some pain around the excision site, but if you keep it clean and you apply the ointments that they gave to you, then usually the recovery is pretty easy. So, yeah.